sometimes not uncommon, but it definitely needs a specialist evaluation. Compared to the father, the mother's age adds to the problem more. In this, the male partner and the family have a very strong role to play because it's a really tough journey for the women.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Alhilal Health World, Nothing But Lifestyle, a talk show with the expert doctors of Alhilal hospitals and medical centers. Today we will be discussing about a topic that is deeply personal, often painful, yet rarely talked about openly. Recurrent pregnancy loss. And the doctor joining us today is Dr. Radhika Telugu, the specialist gynecologist from Alhilal Hospital, Riffa branch. So, doctor, welcome to the show.
Thank you.
Doctor, our topic today is recurrent pregnancy loss. From the medical standpoint, how do you describe recurrent pregnancy loss?
This is a very deep subject. There's a lot to discuss about, but I would try to cut it short and highlight the important points like where the women has to seek medical attention, what exactly is a recurrent pregnancy loss. So, if we divide the pregnancy into 3 halves, like 9 months of pregnancy, the first 3 months is first trimester, second 3 months is second trimester, and the last is the third trimester. So, if the women loses pregnancies consecutively in the first trimester, that term is recurrent pregnancy loss. So, if the woman has already one child, then a miscarriage, then child, then miscarriage, it is not a recurrent pregnancy loss. So, women should have 3 losses consecutively. That is a recurrent pregnancy loss.
How common is this condition, and when should a woman seek medical advice?
It's not very common. Unlike the sporadic miscarriage, a recurrent pregnancy loss is sometimes not uncommon, but it definitely needs a specialist evaluation. So, if a woman has 3 losses consecutively in the first trimester, or if she has one loss in the second trimester, she should go for evaluation to see what exactly is going wrong with her, along with her partner.
Doctor, what are the common causes for this condition, repeated miscarriages?
So, the first and the foremost reason would be the increased parental age. Here, the parents means both the mother and the father, both have an equal share. But compared to the father, the mother's age adds to the problem more. If the mother age increases more than 45, the risk adds up. So, the second cause would be the previous history, like if women has a miscarriage previously, this miscarriages adds upon. So, one miscarriage has 11%, other has 27%, third one will carry 30%, is the fifth one, and so on and so forth. So, number of miscarriages will add up. And the third most important, where we evaluate commonly in our clinics, is the antiphospholipid antibody syndrome. So, this APLA screening is of 2 types, both it is acquired as well as inherited. So, the acquired type is usually causing more miscarriages in the women. So, this APLA screening have 3 components in that. The acquired one in particular have lupus anticoagulant, anticardiolipin antibody, and beta-2 glycoprotein. So, these antibodies, what they identify the own women's cell as toxins, and they try to eliminate it. This is the condition called autoantibodies. So, the own body cells are identified as foreign cells, and these antibodies keep on attacking them. As a result, this miscarriage happens. So, the other one is inherited. Some women will be born with inherited thrombophilias like factor V Leiden mutations and proteinase deficiencies. So, these particular women need special attention. And the other causes, like women are born with genetic conditions, and even the father genetic material also contributes. So, any genetic condition has to be evaluated. And if we take the pregnancy, so the mother, the fetus, and there is another factor which helps in supporting the pregnancy is the placenta. If there is infections causing any problems in the placenta, the women do have pregnancy losses. And the last is the uterine structure. If the uterus structure, sometimes normally the uterus shape is globular. So in some women, there will be developmental defective formation of the uterine shapes. There will be bicornuate uterus, arcuate uterus. There is a septum. There will be wall in between the uterus, or there will be only one horn of the uterus like unicornuate, and so on and so forth. See, these uterine anomalies also causes recurrent miscarriages. But these uterine anomalies, they contribute mostly to the second trimester miscarriages. That is, the pregnancy crosses 3 months and the women miscarriage in the 4th or 5th or 6th months of the pregnancy.
And doctor, what are the tests you suggest for women who experiences repeated miscarriages?
So there will be modifiable risk factors as well as some non-modifiable risk factors. So the modifiable risk factors will be the lifestyle changes. So if the woman is obese, or the woman has pre-existing diabetes, or if she has a thyroid condition where the TSH is elevated more than 4 units, and all these are modifiable risk factors which can be corrected if the woman plans for conception. If the woman comes to us before conception, we can treat her these conditions. If she is her BMI is less than 19 or more than 25, we'll ask her to first correct the BMI before conceiving. And if the diabetes, HbA1c levels are more than 6, we'll ask her to bring her into the normal glycemic state. And a euthyroid also, we have to bring her to the euthyroid status, and ask her to cut off ask both the partners, in fact, the mother and the father, if they have any addictions, they should cut off their addictions, they should exercise more, eat a balanced meal. So in this way, we should advise the patient pre-conception before coming to plan a baby. They should do all these corrections. And some women, unfortunately, they do carry this genetic component that is very hard to treat, and these genetic conditions, we advise them to consult a geneticist, clinical geneticist, where he can do further testing and advise what to do if they want to have a healthy pregnancy. And the AL-HILAL screening, as I already told, we have to do the AL-HILAL screening and do the corrections, and so on and so forth.
And doctor, how important is the male partner's evaluation in recurrent pregnancy loss?
Yes, definitely male also has an equal share in contributing to this problem, because he gives half of the genetic material to the growing gametes, isn't it? So half of the genetic material is carried from the male, so male should also test it for the problem, and he should get his karyotyping tested. If the man has a diabetes, the main problem would be the DNA of the sperm will be fragmented. We call this condition called DNA fragmentation. So all these problems has to be corrected prior to the conception. That means if the woman is planning, she has to come along with her partner to get tested.
And doctor, what are the new treatment options available now for this condition?
Yeah. So these corrections or the treatment options which we are planning, we usually plan in 3 stages. One is preconception, as you already explained before. The modifiable and the non-modifiable risk factors are there, right? So that we will be evaluating first. Suppose if the woman has conceived with this problem and she has come to us, in the conception phase, if the woman is detected with the AL-HILAL positive, so we'll start the women with the aspirin, 75 milligrams of aspirin and low molecular weight heparin. It's a life-saving medication for the fetus. Actually, it helps in good placentation, healthy growth of the baby. So we start as early as the women tested positive for the pregnancy. So that will be continued for 34 weeks, and we have seen very good outcomes. Those who are presenting with AL-HILAL still have a healthy live birth rates with this treatment. And in some cases, the women in their early pregnancy, like they conceive, but within first few weeks they come to our clinic and tell they have a spotting in pregnancy. So that is very usual complaint they come. So we do the necessary assessment, and as a preventive measure, we usually give them vaginal suppositories, progesterone suppositories, where the luteal phase defects or any hormonal imbalance if the women have, they can be corrected. So the Gynecologist progesterone of 400 milligrams twice a day is given to them. And then the woman, unfortunately, if she has a miscarriage, that is in the post-abortion phase. If the woman comes to us in the post-abortion phase, the fetus which she is aborting is a potential material for us to test for the genetic material. So we subject that fetus to the cytogenetic analysis. So we can know what exactly is going wrong with the pregnancy. So in the future pregnancies, we can advise the women to correct these defects if we with the cytogenetic analysis report. Suppose if the woman has come to us in the preconception period, that means that they are planning the pregnancy and both partners have come. That means the fetal tissue is not available with us because she didn't conceive. Then what we have to do is we advise both the partners to undergo a karyotyping. So the karyotyping defects will show what is wrong with the chromosomes of both the partners. According to that, if we find any genetic defects in them, we'll advise them or refer them to meet a clinical geneticist, and he will do further pre-implantation genetics and do the further evaluation. And if they want to conceive with the genetic defects, the best thing is to go for pre-implantation genetic screening and IVF conception.
Doctor, can you now speak about some lifestyle changes that can reduce the risk of recurrent pregnancy loss?
So BMI correction is usually advised for them so that they can have a positive impact in the pregnancy, and we ask the partners to cut off any addictions if they have, and even caffeine intake should be limited, and they have to do exercises, any meditation, breathing exercises, that it should be active at least 30 to 45 minutes of their time they should spend on exercise. This will help in good blood circulation and improve oxygenation to the cells. And coming to that, if thyroid correction is needed, we do it preconceptionally. So if the woman has a TSH more than 4, we usually ask the women to start the treatment for thyroid and do the repeated checking until the woman comes to the euthyroid state. And diabetics, polycystic ovary disease, all this, what happens now, there will be a condition called insulin resistance. This insulin resistance or hyperinsulinemia doesn't allow her to get a good pregnancy outcome. So we generally advise prior to the conception to have these all conditions corrected and then plan a pregnancy.
And doctor, how do you support these patients emotionally when they navigate through these repeated losses?
In spite of the best treatments available with us, the majority, like around 25% of the cases of recurrent pregnancy loss, there will be no cause identified. This is called a 25% unexplained cause. Even though the APLA is negative, diabetes, thyroid, everything is negative, still the women have this problem. So this condition is called unexplained RPL. This condition is unexplained. So in this, the male partner and the family have a very strong role to play, because it's a really tough journey for the women. Yeah, and it's every time a miscarriage happens, again she has to pick up from the scratch and prepare for a new pregnancy. Hopefully she'll give a happy and a healthy baby, and again the cycle goes on. So the women in the right hands and right support, definitely she will have a successful and a healthy pregnancy, and she can take home a healthy, happy baby.
And do you suggest psychological counseling for these patients?
Yes, some non-modifiable risk factors like genetic conditions or this APLA screening, so they have a longer time for the pregnancy to have a successful outcome. In that, the women may lose their track sometimes, they lose their hope. So in that cases, psychological counseling will definitely add on to the treatment.
And doctor, how is the missed abortions different from recurrent pregnancy loss?
Missed abortion is usually a sporadic cause. There will be no associated problems. That means it's spontaneous, first time it happens. Missed abortion will not repeat like a recurrent pregnancy loss. It's a one-time mishap. So in this, the fetus will develop normally, but at certain point of time, the fetus loses its heartbeat, or sometimes the pregnancy sac will be seen in the uterus, but there will be no fetus forming on further checkups. So that is miscarriage. In recurrent pregnancy loss, there will be no such conditions. The women will have a healthy pregnancy, the heartbeat will come, and with no reason the fetus will be aborting. So missed abortion is sporadic cause, and recurrent pregnancy loss has a recurrent episode.
And doctor, what is your advice to women and couples who face this condition?
Definitely, women and partners should be strongly determined. They should seek early medical advice, do come for regular checkups, and do the proper evaluation.
Thank you, doctor. Thank you very much.
Thank you.
So viewers, I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Alhilal Health World, Nothing But Lifestyle, every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.